So, Jason, we have multiple drugs. We also have multiple ways to deliver drugs. And just on a sort of 30,000-foot view, what are the different ways or dosing regimens that you could possibly do with these drugs?
Well, there are probably three established dosing regimens per se. One is what I would call the on-study label approach, which is for Lucentis and for Avastin would be essentially you dose it every month. The CAT data, and I know we'll get into that a little bit more detail, but the CAT data suggested that doing a PRN approach, which is the next one, may not be ideal, certainly with Avastin. So one approach is if you take a look at the results from the Marina and Anchor trials, it was monthly dosing. You got an excellent treatment effect. As soon as you started to cut down on the monthly dosing, you might have seen a little bit of a slide in vision. So on-label study-related dosing. For Eylea, that would be 3 loading doses and then theoretically every 2 months. So that was the on-study label approach. The second approach is PRN, which was popularized by Phil Rosenfeld and the Pronto study, wherein you treat the patient until they're dry, and then you watch them regularly, whether that's monthly or bi-monthly intervals, do OCT imaging, see if there's leakage, and when you see leakage, you initiate therapy again. Some people are using a single injection. Other doctors I know are going another 3 rounds, so again, essentially reloading the patient. So PRN is the second approach, and the third approach is called treat and extend that Bailey Freund first popularized. And treat and extend is based on the idea that in any one patient, in any one eye, there's an interval that you can go before they'll start to leak again. And if you can identify the interval and then back up a little bit, you'll keep them dry all the time. So essentially, give them the loading dose, continue to treat until they're completely dry, and then begin each visit to extend a week or 2 longer. So unlike PRN, which some people confuse the two, PRN, you're seeing them regularly, but you're not necessarily treating them. With treat and extend, if they're dry for every 4 weeks, you would then see them at 6 weeks. So you're giving them just 2 extra weeks without drug. And if they're still dry, you would give them a shot, even when they're dry, and bring them back at 8 weeks. For example, if at 8 weeks they had a little bit of fluid, we know that 6 weeks was okay, 8 weeks isn't, so maybe 6 to 7 weeks becomes their interval, and now you can see them every 6 to 7 weeks, feeling comfortable that they're not going to leak, and monitoring that, in fact, there isn't recurrent leakage. So it's basically on study, PRN, or the treat and extend.